In times of crisis, coming together to help those in need is more important than ever. Right now, families in Myanmar and neighboring countries are facing unimaginable devastation after a powerful earthquake struck the region, leaving countless people killed, injured, displaced, and in desperate need of aid. At Just Wish Foundation, our mission is to bring hope and relief where it's needed most. That is why we honor to support the International Medical Corps in their on-the-ground relief efforts, providing emergency medical care, supplies, and support to communities affected by this disaster.
Hello, everyone. This is Henny Espinosa with Just Wish Foundation. On March 28, 2025, a 7.7 magnitude earthquake hit Myanmar, causing widespread devastation and claiming thousands of lives. It also caused significant damage in parts of Thailand, China, and Vietnam. International Media Corps, a global nonprofit humanitarian aid organization, is on the ground, helping those who need it most in the wake of this disaster. Joining us now is Todd Bernhardt, Senior Director of Global Communications of the International Medical Corps. Thanks for joining us on Just Wish Foundation, Todd.
Of course. Thanks for having me.
Todd, this quake is one of the strongest to hit Myanmar in a century, claiming over 3,600 lives and injuring thousands of people, with hundreds still missing as of this interview. Tell us about International Medical Corps' relief efforts there.
Yeah, this is a catastrophically strong quake. 7.7 is enormous. You mentioned the death count and the injury count. Right now, the death count of confirmed deaths is a bit more than 3,600. We expect that to continue to rise a lot as search efforts continue. We have sent a strike team of 4 people that are now in Myanmar. They're in the field assessing needs. They're meeting with local and regional authorities, and they're also working with local and international partners. I was talking with them yesterday. They were in a town called Napita, and that is about 7 hours north of Yangon, where they had originally traveled into the country, the capital. And now they're traveling today. They had a lot of meetings yesterday, and now they're traveling today up to Mandalay. And all the travel is, as you might imagine, very difficult. The roads are really damaged. It took them 7 hours, as I said, I think, to get up to Napata, and another 3 hours to Mandalay. The reason they're there is, in addition to assessing needs, is, I said, working with partners and regional authorities to make sure that we can get our emergency medical team, our larger emergency medical team, into the field. And by emergency medical team, I mean not only the people that would be involved in that, but we have various facilities that we can deploy too. So we're the only non-governmental organization that is classified by the World Health Organization as a Type 1 emergency medical team for both fixed and mobile configurations.
Okay.
And so what that means is that we can essentially deploy an outpatient field hospital. It has an emergency room. It can provide a wide range of outpatient services. It's something like 50 tons.
Wow.
We work with various partners, logistical partners, to deploy that around the world. Or we can do a mobile configuration where we send equipment and people in. We get trucks, we get other equipment needed to go out into very remote locations and provide care to people as they need it. Our fixed location can treat anywhere from 100 to 200 people per day.
Wow.
We've done more than that, of course. And then the mobile configurations are much smaller. They do about 50 to 100 people per day. So we're looking for opportunities to do that.
Yeah.
We also are looking at, there are already a lot of responders on the ground. And so we might, if all that is needed is to provide surge staff, then we'll be doing that and sending staff to those locations. Because as you might imagine, the people who are healthcare providers in Myanmar are personally affected themselves.
Yes.
And so, of course,
And may
they
need care themselves. Yes.
exactly.
Yeah.
And they
Yeah.
need to take care of business and take
Yeah.
care of their families and other things like that. So that's also one of the reasons that we do what we do at International Medical Corps, where we try not to go in and set up a parallel health system. What we try to do is go into the countries that have experienced disasters and work with the existing system to strengthen that system, to give them the training and the capabilities and the
Mhm.
equipment and supplies that they need, and the people if needed.
Mhm.
And then when we leave, we try to leave those facilities and countries stronger than they were before
Yeah.
so
Yeah.
that they are more self-reliant and able to better deal with the disaster if it comes
Yeah.
along again.
So I'm assuming a lot of this, Todd, requires collaboration,
Yes.
communication with the agencies, with the government, with the entities there. Because as you said, each really country is unique, kind of like
Yes.
what their needs are. You have to assess, and that takes a lot of time being there. My understanding, Todd, is that prior to this disaster, International Medical Corps has actually been in Myanmar, right? And
Yes.
many parts of the world. Tell us about that, kind of that you guys have been there,
Oh, yeah.
really setting up your roots there and making sure that when disasters strike, like such as this one, you kind of know already the area.
Yeah, well, we were founded in 1984. We have more than 40 years of experience providing humanitarian aid in difficult and dangerous environments and in low resource environments.
Mhm.
This is a classic example of that because there's been so much damage to infrastructure throughout the country. It was really hard to get our people inside. There is not only the physical damage that's made airports non-functional and roads broken, but there are the other it's an active conflict zone.
Mhm.
And so it can be difficult just to get people inside. But we're used to doing that.
Mhm.
We had responded to Cyclone Nargis in Myanmar in 2008. There were instances of widespread flooding in 2014 and
Mhm.
2015 where we were in the country and responded. And in fact, one of the people on our strike team is a gentleman who used to work for us in
Mhm.
Myanmar when we had our
Mhm.
country mission there. And so he stepped right back up and
Mhm.
wanted to help the other people from our team, which include a doctor and a logistician and, a person who's the team lead and
Mhm.
has government connections there.
Mhm.
And so they are, able to go in. And
Mhm.
this is typically what we do when we go into a country when a rapid onset disaster like this has occurred.
Mhm.
What we do is we send in a team right away to figure out how we can then best help, and then we deploy the larger team afterwards. So
Mhm.
right now we're in about 30 countries around the world. We help people that are affected by conflict, disaster, natural disaster, disease. These can be rapid onset emergencies like an earthquake, or they can be longer term
Mhm.
emergencies like a flood or a long-standing conflict or something like that.
Yeah, yeah. Todd, you were talking earlier about kind of challenges that the medical team, has encountered. How are they able to overcome these challenges and really get to the areas that need their help?
Well, one of the reasons we always send a logistician in is because logistics and procurement and getting the equipment you need to get around and to provide aid is so important.
Hmm.
And then we always work with local partners. We, as I said before, we plug ourselves into the local healthcare systems and we work with the ministries of health. We had meetings yesterday with the Deputy Prime Minister and with the Ministry of Social Affairs and other players so that we could get all the necessary permissions to be able to get where we needed to go.
Hmm.
So because we have a lot of experience, because we have existing relationships with international organizations like the WHO, then we are known and people ask for our help and we're able to get in there and overcome these challenges.
Hmm.
Now, in this particular situation, some of the challenges that we're facing is that, as I said before, there's conflict ongoing
Hmm.
throughout the country.
Hmm.
There were high humanitarian needs that existed even before the quake. The conflict has damaged the healthcare system. There is not, even before the quake, there really wasn't enough healthcare facilities. There weren't enough healthcare facilities. There wasn't enough equipment. There wasn't enough medicine. There wasn't enough staff. So now everything is harder.
Hmm.
And that's why we're in there, and that's why we're sending people, and that's why we're ready to send
Hmm.
even more equipment and facilities and people as needed. The bureaucracy and the red tape that we're facing are high too. But
Yeah.
again, we've been doing this a long time. We're used to operating in low
Yeah.
resource environments, and we have a methodology that we follow, a proven methodology that
Mhm.
we follow to make sure that we can work within the local healthcare system to meet needs that need to be met in both in the immediate future and to build capacity for longer term
The
needs.
longer term, which is
Yeah.
so important as well. Todd, tell us about the members of this medical team. Are these volunteer doctors? How can people help if they're in a capacity to help this medical team? Because, they're doing such an important work in
Yeah.
Myanmar and many parts of the world. Yeah.
Yeah. We are, our strike team is made up of staff members who have gone in. And there is one volunteer, as I said, the gentleman who worked for us before, but he is a former staff member. Now, when we deploy the emergency medical team, we will be pulling on our emergency roster. We have doctors and nurses and other clinicians from throughout the world
Hmm.
whom we have pre-vetted and who have experience going into disaster zones, and they know how to they know how to operate quite literally in that sense of the word without the latest technology. And so they're able
Yeah.
to go into these
Yeah.
environments and deal with sleeping rough and 15-hour work days
Yeah.
and not always having the latest equipment and high temperatures and
Yeah.
working in a tent. So we will pull on that emergency roster. We will also have other people on the ground with them who will facilitate the response and make sure that the clinicians, the healthcare providers, can do their work. And so it's quite interesting, actually. There are a lot of different aspects of what goes into a humanitarian response, and a lot of different people who play different roles. So, as I was talking about, logistics is incredibly important. You need a seasoned logistician who knows how to procure items, move them across borders,
Mhm.
get them there in a timely fashion for the lowest cost.
Yeah.
We need security because no matter where you are in the world, we're going to be seen as an outpost of
Mhm.
aid, and people are in need.
Yeah.
So you need to be able to provide them with the help they get and protect your assets and your people so that they can do their work unhindered. What we try to do is when we go into a response, we want to pull on local talent, which is usually quite substantial, but these people have been affected. How do we get them to help us out? A lot of times people are looking for an opportunity to pitch in and help out.
Mhm.
So we work on that. Then, there are other aspects of this as well. There's finance. We have to buy
Yeah.
equipment. We have to
Yeah.
pay staff and volunteers sometimes. So lots of different pieces go into solving this
Yeah.
puzzle. But yeah, hopefully that answers your
Yeah.
question there.
So, but in terms of the community wanting to contribute, do their
Yes.
part and support your team that's out there. If they're not at that capacity medically, or like, they don't have the
Yeah.
skills for it because it takes special skills. How can they help? We're talking about financing. We're talking about that. What are the different ways that the community can step up and really be there for Myanmar?
Right. I like to talk about money, time, and influence, really, when it comes to helping out. Obviously, money is the best way by contributing to International Medical Corps, and you can find us at internationalmedicalcorps.org, and Corps is spelled CORPS, like the Peace Corps. There are many opportunities to donate to our work around the world. As I said, we're in about 30 different countries, and we're responding in a variety of environments. If you have the skills to be able to sign up for our emergency roster, again, at internationalmedicalcorps.org, you can find opportunities for volunteering. And what we do is if you have the skill set, we will end up talking to you, we will vet you, we will make sure that, and if you're accepted, you essentially get ready to deploy at a moment's notice, because with a lot of rapid onset emergencies like this, you don't have time to suddenly get vaccinations or to get a visa or to do anything else. And then influence is the last part of that. And It's a really important part, especially nowadays where everybody is living in the digital world. So if you find out about us and you like our work and you want to help support us, tell your friends and family and other people that you know about us. Let them know about the important work that we're doing around the world. The world is a dangerous and unpredictable place, and we always are looking for resources and people to help us out and for people to talk about our work and why our work is important. So, and we would appreciate any help people can lend along those fronts.
You know, your team has seen the worst destructions, but the silver lining here is that you bring hope. You bring hope to people, and that I think is the most important. You bring human kindness at times when you really feel like you're running out of hope, and that's life-saving in itself.
Yes.
And
right.
we applaud you guys, International Medical Corps, for what you do, not just in Myanmar, but in different parts of the world, not just in times of quakes, but in all kinds of disasters and emergency responses. You are there on the ground. And at Just Wish Foundation, we are just honored that we are able to do our part to support you guys. And it would be great if for people that can hear this or see this interview, for them to also step up and help. And how can they help, Todd? Where can they go to check out and help International Medical Corps?
Well, internationalmedicalcorps.org. So it's a long name, but you can find us out there. And again, Corps is spelled CORPS, like Peace Corps. And it has, our website is full of information about all the work that we're doing around the world. As you were saying, we are providing hope to people. We are in there providing aid right away when they need it, but then through training and other capacity building work we do, we try to make sure that they are more resilient. It's the whole teach a person to fish philosophy that we always have gotten behind since we were first founded in Afghanistan more than 40 years ago.
Wow. So it's the long-term help, and that's where we need people to support those long-term efforts, not just the immediate efforts, because this is this disaster in Myanmar. It's gonna take a long time.
It will, and I should add too that we're talking about medical care, but there are so many other aspects of a response. So there's significant mental health care needs too that happen when an emergency like this in Myanmar occurs. There are protection needs because vulnerable populations, women, girls, children, the elderly, the disabled, people like that need even more help because everything has gotten destroyed and there might be people out there who are going to take advantage of them. There is the need for nutrition and livelihoods assistance. And then there is a very important component of our work that we call water, sanitation, and hygiene. And as I was mentioning before, right now the population is living outside. Everybody's afraid to go back into their house. It's very hot there. It's raining. You have standing water. There's no electricity for pumps if you have access to clean water to pump the clean water out. And so there's a real risk for infectious disease and everything else that's going on there. So that's why with this particular emergency right now, of course, we need all the support we can get. And we really appreciate your support too at the Just Wish Foundation. So thank you.
Of course. It's our pleasure, Todd. And again, more power to you, more power to International Medical Corps, and we can do this. So thank you so much. And prayers for Myanmar, and all the support is needed right now. So thank you so much, Todd. Thank you for taking the time to talk to us, and more power again to International Medical Corps.
Thank you for inviting us.
Thank you. Bye, Todd.
Bye.
Talk soon. Thank you.